Okay, who the NCHI are. We're a bunch of private individuals, no real healthcare background, but all of us have actually been indirectly or directly affected with healthcare-acquired infections, from Clostridium difficile to MRSA to numerous other healthcare infections that are out there right now. We don't specifically look at one type of infection. Our aims and objectives are, like everybody else, to keep raising the profile of HCAI, to stop government from walking back on any commitments they actually make, to promote patient safety, to provide support and advice to those patients when they do actually suffer the healthcare infections. We have a phone line that patients can actually phone into, and provide information to patients going into hospitals and those people that have come out with infections. We are realistic about our goals and objectives. We're here to hold people to account, as I say, to get away from this blame culture and away from the point where everybody litigates against one another. We work in partnership with healthcare providers and to improve patient safety. As I say, it isn't our job to shout and scream at you, it's our job to help you and help you get your message across to patients. It's not, as I say, we're not trying to throw things at you or whatever else. It's a case of work together. You know, patients out there, my father could have litigated against the hospital, but what good would it have done? It would have just taken money away from the NHS and nothing would have changed. Hopefully with his support, I can achieve some of these goals with the NCHI. A little bit about my father. Here he is, being actually interviewed by Lawrence McGinty, I can never get his name right, from ITM back in 2006. Father was a big, strong man, naval man, never cried in his entire life, went into hospital, had early stages of diabetes, went in to have his diabetes stabilized, stubbed his toe in the hospital, and unfortunately got an infection in that toe through the wound that was actually apparent. And after literally a very short period of time, it's amazing how quick the infection actually got hold, had 35% of his foot amputated, his right foot amputated. After the operation for amputation, he left, went home, and about 9 months later, unfortunately, he caught himself on his left foot. That actually made, I'm sorry, I'm gulping here because every time I remember it, it still brings up the emotions again. He got an infection in that foot. He was never told about trying to decolonize himself after the infection. He went home knowing that he had an MRSA infection, only primarily because I looked at his notes and actually said, oh, you've got an MRSA infection, this is why they're doing this. But left, went home, got the infection again in his left foot, went into hospital, had 45% of that foot amputated, got osteomyelitis, Charcot, and all kinds of other complications. Unfortunately, he ended up with his foot becoming detached from his leg, and literally his foot was 90-degree angle to his actual leg when he tried to walk. Went in last year for reconstruction work. Unfortunately, due to all this strain of this 5-year period, put a large strain on his body and died of a major heart attack or coronary last year in December. His thing was he hated hospital, absolutely loathed them, and didn't ever want to go back into one again. And when he was forced back in, literally clinging onto the furniture because he didn't want to go back in again, knowing what the consequences of that may well be. So from that, I went off, I gave up my career and went and worked with the Infection Control Nurses Association, with a number of other charities as well, to try and raise the profile of healthcare-associated infections. I'm not qualified like you guys. I don't ever confess to be, have all the answers and such like, but from what I gather from most of those meetings I've been at, most of the things you talk about are seen to be common sense. But from a patient's perspective, these are some of the comments we get very regularly. Hospitals are terrifying places. Patients who've never been into hospitals still think, or potential patients think, that hospitals are these nightmare places you don't ever want to go to. There's actually like a feeling out there right now that if you go into hospital, you're bound to get an infection. Not true, we all know that. But that's how people actually think out there. I'm sure you've already come across this. All of us are potentially patients for the NHS and the healthcare system. They actually believe there's no pride in maintaining cleanliness. I know that things are actually changing and things are improving, and I hope they improve more radically, but that's a general feeling out there right now. They actually believe also that care standards, not necessarily medicine standards have changed, but the care standards have changed within hospitals. They also don't have anywhere to complain to, or don't believe they have anywhere to complain to when they go into hospitals. If they, we all hear the stories, that doctor didn't wash his hands, but why didn't you tell him? Why didn't you have the get up and go to actually tell them, no, you're not coming and touching me because you haven't done any decontamination, you haven't used alcohol gel, you haven't washed your hands from that last patient. And they need to actually understand that.